You're listening to Physician Non-Clinical Careers, episode number 333. How to practice hospital medicine and found a startup. Interview with Dr. Adam Robison. Today I'm interviewing a busy hospitalist leader who carved out time to co-found an EHR optimization company. You may have never heard that term before because I don't think they existed before his company opened up. Anyway, today he'll explain what his company does and how he continues to provide patient care while serving as CMO of a growing business. Before we do that, however, let's hear from our sponsor. By the way, did you know that you too can sponsor the Physician Non-Clinical Careers podcast? As a sponsor, you'll reach thousands of physicians with each episode to sell your products and services or to build your following. Your message will be heard on the podcast and seen on our website and our newsletter and in social media posts. To learn more, just contact me at john.jerica.md@gmail.com and include sponsor in the subject line. Now, Dr. Adam Robison completed medical school and residency in internal medicine at the University of Louisville. He's practiced hospital medicine and held several leadership positions, including his current role of physician and chief hospitalist at St. Luke's Health System in Idaho. As a medical provider, he has witnessed the challenges posed by electronic health records, and that's what prompted him to establish AI Medica, an electronic health record optimization company that integrates evidence-based medical calculators with EHR data to enhance patient outcomes and alleviate EHR burdens. He presently works as Chief Medical Officer at AI Medica, in addition to his clinical and administrative responsibilities at St. Luke's. So just so you know, what this tool does is it integrates with the EHR and it accesses information that can then go into those formulas and algorithms, and we've got to calculate something or figure out the risk of a DVT or a PE, something like that. It pulls it and it does it all automatically. Go figure. They never had integrated these kind of functions in an EMR before, and we discuss why that is, because there's been new updates in the way that EHRs are designed that enables this to happen a little more easily than it could be done in the past. So with that, let's meet today's guest. I'm really happy to meet today's guest because besides being a hardworking hospitalist, he's a hospital manager and leader and founder of an EHR optimization startup company, which we'll talk about for sure. Hello, Dr. Adam Robison. Thanks for coming today.
Thank you so much for having me.
I'm very happy that you're here. This is going to be very interesting. People know that I have an affinity for hospital management work. I was a CMO of a hospital, and I know a lot of physicians are always trying to get away from it, but I always like to talk to people like yourself who are in hospital leadership positions and, of course, and also an entrepreneur. So this is going to be fantastic. So let's just start by you telling us a little bit about your background, education, clinical career, and then we'll get into the other stuff after that.
Yeah. My name's Adam Robison, like we said. I'm an internal medicine doctor. I trained at the University of Louisville. I'm a big Cards fan. We did pretty good this year in football, so I was pretty happy about that. I've been working as a hospitalist clinically for the past 7.5, almost 8 years now. I work in a small community hospital out in the middle of nowhere in Idaho, in Twin Falls, Idaho. So it's a great place of practice, and I've been out here for a while and be here for quite some time. On top of that, I do work as a lead hospitalist for my group. There's about 120 providers, and we cover about 4 or 5 sites right now. And so that's been interesting work. I took that role about almost 3 years ago, right at the middle, kind of beginning or stages of COVID. So that was a very interesting time to take over as a leader of a large hospitalist group and try to navigate through that. That was good learning.
Yeah, I'm tempted to say, well, okay, how did you solve all those problems of people being too sick to work and not having enough PPE? But we won't get into that.
No.
But it's been interesting, huh?
Yeah, it's been interesting work. And then, as you said, I did found a software optimization company about 5 years ago, almost 5 years ago, in 2019. And so that's been a lot of work too. So it's been a lot of interesting stuff, keeps me busy, and a lot of different things to focus my attention on for sure.
Well, it's that second part that really, got me interested. And I think our listeners are interested in things like outside work, side gigs, side jobs, new careers, passive income, active income. So tell me what inspired you to start a new company. We'll see if your story jives with the others I've heard in terms of what makes people do crazy things like that.
Yeah, I've been happily married for almost 20 years, and my wife, I asked her one day this crazy idea. I said, "Hey, I want to take some money, and I have this idea of how to make the EHR better." And she said, "We'll have at it." And so basically, I remember sitting in front of my computer. I was using Epic at the time, using electronic health record, and going, I have to go to a third party website to finish some work. I have to go outside the EHR on a regular basis. I'm like, this, I have to take data from here and go look on a chart and go over here. This seems kind of stupid. Is there a better way of doing this? And so initially, I tried to do what I did initially within the EHR with some templates and stuff like that. And what I was looking to do wasn't actually possible within the EHR framework, the logic and the kind of advanced computing I wanted done. And so that's what, caused me to think about, is there a way of doing this? And I did a lot of research. I was reading all sorts of websites, educating myself on interoperability standards, data interoperability standards. How does that work? Is there ways of doing this outside the EHR without really tight integration, customized integration? And that's what we came across. I came across something called HL7, which if you're out there is fire. And we learned a lot about that. So really what was interesting to me was a problem that I had clinically, and could I solve it? And that's what led me to found the company, realizing that would require founding a company to develop the software and to go from there. So that's what we did.
So that is the common thread that I've heard before. I talked to a urologist who started a company producing underwear for patients and, whatever, other different entrepreneurs. And it's always that itch that has to be scratched. You have a problem of your own. And it's like, there's got to be a solution to this problem. So
Right.
that is very consistent, but I'm sure the way you went about it is going to be different from others because there's a myriad number of ways of doing that. So I guess we'll get into what it does exactly, but what was your next step? You had this idea. What did you do?
Yeah. So whenever you have any idea, like if we're trying to find is there a market out there for it? Is this something that people would buy? Is this a universal, or at least a broad enough problem that people run into it? And that's, I talked to lots of different physicians and people I knew, people at different hospitals I had connections with, and asked them, is this a similar problem you run into, or am I just dumb and somebody else has already had a good solution for that? And realize, no, this is a fairly universal problem that everybody else has experienced. There's not a lot of solutions out there in the market. And so that's when I go, okay, now I don't know how to code or spell software, so I don't have any experience with that. And I knew it would probably take me quite some time to do that. So that's when I was looking around for people that knew how to do that. And I was able to, find some developers and had some of those skills I had. So it's a lot. There's stories about of how to get licensing and getting approval through different EHR vendors. That was an interesting experience to go through, trying to convince certain Epic that I was a company and that I want a license to put myself on there. So learning how to navigate all that, security protocols, yada, yada, yada. Just a lot of learning new things that I didn't know before.
Interesting. But I just want to make sure that I didn't miss another point. You checked around to see if this was a universal problem. And did that include like other EHRs than the one that you were using?
Yeah, so I talked to a bunch of physicians, because what I have learned about, and it sounds like you talked to other doctors that have used this, but physicians are the best people at solving physician problems, not some sort of a Silicon Valley backed startup by a bunch of two guys out of that are 20s, like, oh, they know how to fix our problems for us. It needs to be physicians fixing physician problems. And so I talked to a bunch of other doctors that have been in a myriad different EHRs. I talked to people that used the big ones in the market, as well as like the VA. I was talking to a bunch of colleagues who work at VA. Is this something that you'd experience out there? And it was, a pretty universal experience.
And let's see. So I guess I see when I looked on your LinkedIn, or I looked at the company's website actually, and tell us about the company. Let's start there. Tell us what the company is designed to do, or what kind of product or service it provides. and then I'll come back to some of these little questions in here.
Yeah. So the problem we were trying to solve was how to get data out of the EHR. Was the problem, right? So that's a big issue. Healthcare data and how it's siloed right now is a big problem. And that's why I kind of touched on briefly something called the HL7, which is a group. They developed these interoperability standards. It was very serendipitous timing with what I was trying to do, because during that same time, the 21st Century Cures Act had come out. And the 21st Century Cures Act, for those that are familiar, opens up the chart. It basically, like for a lot of physicians, it meant that patients now could access their notes in real time, which is caused a lot of physicians some heartburn. Like all of a sudden, the chart became a lot more. It used to be my note. Now it became the patient's note as well as my note. And that was some heartburn around that. But if you actually looked into what the 21st Century Cures Act was doing, it wasn't just making notes available to physicians or patients, even though that's how we, a lot of as physicians, interpreted. It actually made the data in the HR transparent and accessible. It had to be accessible. And it turns out the government had adopted these things called the HL7, this standard called FHIR. And it just happened at the same time while that was going on that I was trying to look to solve the same problem of how to get data out of the EHR and do something with it meaningfully. And so what our tool does is it integrates directly with the patient's chart. It looks at what's going on in the patient's chart, and then pulls all the information that's would be relevant to pull out, provide the user, reviews the chart essentially for the user, and then provides information like MELD scores and things of that nature, as well as coding recommendations, all within the context of the patient's chart.
Interesting, because earlier I was going to jump on the bandwagon and badmouth some of the EHRs and EMRs. It's like you would think after helping physicians doing this for 10 or 15 years, they would have figured this out. But what you're telling me was the system wasn't necessarily ready for it, and it became ready as this was implemented.
Yeah, no, it's been interesting. I tell a story. I have a good friend of mine who's not a physician, and him and his wife, they recently had a child, and they were receiving care locally to smaller hospitals, but the child's medical condition required it to go to seek care at a tertiary care center. And what they described, even though both centers use the same EHR, they're separate EHR instances. And so the mother and the child had two separate records that were actually very important, but they need to talk to each other because the conditions they were seeking care for were the same at both sites. But it became and this is just recently. And so for whatever reason, there hasn't been a lot of interest in the major EHR vendors to make, even within their own EHR network or broadly between EHRs, that hasn't really been an interest that they've wanted to go down, either maybe for economic reasons or technical reasons, for whatever reason that it may be. That interoperability standard piece has been a big problem. And so and they haven't been willing to fix it. And the Cures Act did mandate they had to open that up, but it is going to be it's going to be important on companies like mine, other companies out there, to do that work for them.
Okay, that's good. That things are progressing, and like you say, your timing was perfect. Now, I was looking at your website and kind of reading a little bit about this. So I just want to make it clear for the listeners, because some of them might actually need to use this tool at some point or tell their hospital or, somebody about it. But there are different kinds of, I guess there's metrics, there's algorithms, there's sometimes formulas that have to be used by a clinician in trying to do something. And right now you have to either do that by hand or use a separate piece of software or an app on your phone or something. And you're integrating that. So give us more about how that works and why it's potentially a profound,
So our two applications right now, we have two software pieces called AI Calc and AI Code that live within our AI Medica platform. And what they do is the AI Calc, you can imagine it just being, your medical calculators, your cirrhosis scores, your CHADS VASC, you name it. There's a million of these out, and they're actually propagating pretty rapidly now with the advent of big data and smart computers. These models are coming out pretty rapidly. And basically our software basically looks at the patient's context, what kind of medical problems they have, what is their other criteria, and says, not only we'll calculate, the patient has cirrhosis, you'll need a MELD score. And then we'll give you the most up-to-date MELD score, give you that sort of stuff. So you don't have to click around. Even if you just click the button, you don't have to think of what look that you need a MELD score. We'll just review the patient's chart and give you all the relevant scores and pull the data in to calculate the scores for you automatically, which I think one thing I say to people all the time, I use this tool every day in my practice. I developed it for myself, and then so I'm constantly trying to improve it. And then we also do the same thing with medical diagnosis codes. So we try to optimize the most the best, highest weighted codes for DRG weighting for hospitalizations, which is important because we can look at a patient's chart and say, oh, the patient actually meets sepsis criteria and you're treating the infections. That should be the code you put in the chart. Let's provide that. And that has a huge ramifications so that anybody knows in the healthcare space, those DRG weighting is huge for hospitalizations for reimbursement.
Yeah, absolutely. And someone like you or many hospitalists kind of have looked at the Medicare guidelines and they realize that for some DRG level, whatever, it's like a 3-paragraph description of what goes into it. And
Right.
oh yeah, we have time to really learn all that. Not
Right.
really.
And I tell doctors don't care. I tell us that you've got to optimize it and make it easy for me because I don't care if patient needs sepsis or pneumonia or what. I know they have an infection. I know how to treat it, and I'm going to treat them appropriately. And I don't really care what name I put on the chart. All I care is that my patient got better because I gave them the appropriate care.
Well, this is really going to impact the CDI people, if this is going to really help them a lot, I think. So that's interesting. So it sounds to me like this business really is like a software business. So, and you said you're not a programmer.
No.
So how did you overcome that issue?
Yeah. So it was interesting. So I had this idea. I got to fix this problem. This is a universal problem. How do I fix it? Well, oddly enough, I had been reading in our local newspaper, and I came across this guy here locally that I knew, where I didn't know him at the time. That he had a kind of a developer for hire company, development for hire. And so I just kind of reached out to him and I said, hey, I got this problem. What do you think? And he said, oh yeah, I could do that. And by the way, I'm partner of a venture fund. Let's see how this goes, and we may invest in your company if you like the idea. And so I pitched to them, and that was kind of very serendipitous that we build a minimum viable product. And after they were comfortable with me and they're kind of filling me out to see if I was not just a fly by night operation, they decided to invest in the company, my idea with me as well. And so that was how we got married with a venture fund. It was very interesting how that kind of worked out. But just from a paper article, I just happened to come across it.
Sometimes things just work out, but I always say the RAS in our brain, the reticular activating system, once you're thinking about something, it finds things that you otherwise would never notice,
It's like when having... you buy a brand new car and you notice everybody else has the same exact new car, right? As you.
Exactly. That's it. Okay. So let's see. I lost my train of thought. No, as far as so did you personally, how did you sort of protect, or did you, the intellectual property of the fact that you had come up with this idea? Was it kind of built in your partnership, or, how do you do that?
Yeah. So that's an interesting thing. That's something we've still wrestled. So when you develop software, you really can't patent software unless your approach is really unique. If you developed, blockchain, if that's a whole new software thing, you could potentially patent that. But just patenting software, it's almost like copywriting software. You can copyright it, but anybody can write a piece of code. It's not a unique idea if you're writing this code using typical programming language. So that was a difficult problem. We have now developed the proprietary knowledge base and an ontology, if you will, that is IP and that is patentable, and we will be patenting that. What has helped us right now, and why we're 5 years into this right now, or almost 5 years into it, is what I'm doing ends up being very technically difficult. We have a bit of a moat around us because even the developers I hired, they didn't know how to do this because it's not a skill set you can hire off the shelf. And so it was a lot of going through a lot of that. So it's ended up being, like I said, a lot of it's been very serendipitous that turns out this isn't something you can even hire very easily for. And we had to train a lot of people up and work through it. But I think one thing we did was when we developed the protecting IP, we had that written to our contract with the development company. This was our stuff, and we had all well demarked within the contract negotiations.
I guess on the plus side, the more complicated it is, the less competitors you'll probably have doing it.
Yeah. And we're many years into this point. At this point, there is, in this smart on fire space, and unfortunately I'm saying it on a widely broadcast podcast, but it is a brand new space. People are starting to understand and realize that that's how you talk to these EHRs. And what's great about it is it's EHR agnostic. Every EHR has to be compatible with these standards now.
Now, one thing I'm not an expert on at all, and I've heard, there's different ways of getting investors, but, like venture capital, angel investing, this kind of thing. But did you end up just getting the one entity to support this when you got your partner, or did you go beyond that?
No, so it's been we've had a raise. Done a few raises now. No,
Hmm.
it's been interesting. No, that was a lot. That's been a lot of work to raise money. I mean, I funded the initial development of the minimum viable product, but to actually bring on employees full time, and I can't. That's not something I could afford to do. I don't have those kind of deep pockets. And so what we did was, yeah, we raised it through the initial investor network that we were introduced through that venture fund, and then rest through their network. And that got us to a certain point. And then when you raise money, every time you raise money, you're looking to say, I'm going to raise money, hit these milestones. And so we hit every time we've raised money, we've hit this money is raised, hit these milestones. We've hit those milestones. Now help us, we're going to raise money again to hit these milestones. So you're trying to show forward momentum every time you're raising money that, yeah, we got this money. We did X, Y, Z with this money. And now we're going to do, these next set of milestones, which are going to further grow the company. We're hitting these metrics and milestones. And that's how when we've raised money through different networks, that's how we've done it. And so that's where we're at right now. We've raised, I think, about $1.5 million over the last 2 years to
Okay.
expedite development and move the things forward.
Nice. Yeah. I mean, there's a lot. It's not like something you can build in your basement. so,
No, and it's a
so,
lot of learning. I think anybody looking to start a business just prepared to learn a lot, because even though you may be smart as a doctor and you're very intelligent, be prepared to be very humble, because you have literally no idea. You're gonna have to learn a lot, fly by the seat of your pants, and that's kind of why people become entrepreneurs. They're interested in learning that stuff. But yeah, I've had to learn a lot, and I made a lot of dumb mistakes, and all sorts of stuff. Lots of stories to share about
oh,
that.
I can imagine, but boy, it can be exciting, and it's physicians can learn anything really if you
Yeah.
think about it, as long as you have the time.
Yep.
That might be an issue for you, as the thing gets bigger and so tell us where it is right now. You've been doing this for 5 years. I mean, obviously there was a whole ramp up, but
Yeah.
so do you
Yeah.
have clients? Is this thing
Yeah. Yeah.
live? Is it working?
Oh yeah, it's like I said, we have two clients right now. We have two head systems right now. The biggest thing, actually, we just finished up our installation at the VA. So that was a big deal to get our software working with CP. If you're familiar with the VA, worked in the VA, they have an antiquated system called CPRS. It's been around for a long time, and they've just recently built on a platform called onto their CPRS called Lighthouse, that's compatible with Smart on Fire with new Cures Act coming out. And so our tool, we're the first third-party vendor. They're looking for a solution like ours, and we met them and talked to them, and they talked to some other people that could do something similar, but we were a better fit just because of our tight integration with the Smart on Fire standards. And that has allowed us to work with them. So we just finished our deploy there. We are in the process of several other health systems we have relationships with the biopharmaceutical company, as well as a clinical research company that's looking to use our tool to help automate and augment data retrieval from the EHR to help expedite clinical research. And so that's what we're working right now. So,
Okay, so is it to the point now where some of the medical caregivers, the physicians, APNs, whoever, are they seeing the benefits at this
oh
point?
people love the tool. It's being used. We have some business intelligence software. We monitor the use of software, how people are using it, so we can make sure we can improve it. And yeah, we've seen, I wouldn't say it's not quite exponential growth in the number of users, but we're seeing lots of people using it almost on a regular basis. And it's now becoming the way you do things now with our sites, because why would you go to a third-party website or go to some other site if it can
Yeah.
go with HR? It just saves you button. It's a button click. You don't have to do more work. So
Uh,
it's obviously much more efficient.
Yeah, nice. I mean, do you have different formulas or different, tools available over time, or is there a list of 10 or 20 or 1,000 or what is?
Yeah. So right now we have, I think, 50 or 60 medical functions automated within the chart. They're the ones that are commonly used. We're adding more as they come out in literature. We're adding more. We're branching out the behavioral health space now with some of those assessments that need to be done. They're very often done on paper or through PDF forms. So we're bringing that in the platform as well. So really just looking, depending on what clients need. Really the hardest part, I tell people all the time, the hardest part with this is actually just getting integrated the EHR and getting data out of it. Building a medical function, a medical calculator form, you need to get data out of the EHR. That's easy now. We can build that in a few days. You name it, we can build it, because that's not hard. The hard part is actually integrating the EHR, and that's the hard part.
Kind of like that interface, or if
Yeah.
that might not be the right term, but um Are you doing studies to see if this improves the efficiency of
We,
the physicians?
yeah, we will be. That's going to be our that's going to be next year's. We have a couple sites that are interested in doing that. Our Richmond VA site, which we're in the process of finalizing that, they're interested in doing that kind of work. So we'll be working with them to hopefully show that this is efficient, which anecdotally, of course, it is. But we'll be able to show that and prove that with data we collected.
Yeah, I mean, the thing I hear from physicians, I have to go home and do an hour or two of notes, or whatever. Now that's oftentimes the clinic, but still, even hospital notes. Sometimes you just can't get them done. You have to go back.
No.
So now, do you have a lot of capacity now? I mean, if people listen to this, I mean, we don't have a million listeners, but a lot of these physicians might still be working clinically, and
Yeah.
how do they get a hold of you or the AI Medica to learn more about this? Is it ready for that?
Yeah. Oh, yeah. No, we're ready. We're actively taking on clients now. Like I said, we're in the process. That's going to be a kind of our big Q1 push. We had a couple of clients that we're working with. Now we're ready to go live with everybody else. And so that's Q1. That's what we're working on lining them up. You go to our website, aimedica.ai. It's easy. Easy website to remember, and just go there. There's a contact us page. We're happy to do demo for clients and potential clients, interested people.
Okay. AImedica.ai.
That's correct.
All right. And if they have more questions, they can throw a note in LinkedIn to you,
Yep.
perhaps. You
You
have
can find
time
me
for
on
that?
LinkedIn or you can email me at adam@aimedica.ai. It's very easy.
All right. This has been very interesting. I don't think I have a lot of other questions. Let me ask you this. What if I was going to go to my local hospital and say, hey, this thing sounds pretty cool. Who would I go to?
You want to go your either chief information officer typically. So we go through and they would request us through. There's
Yep.
most of the EHR vendors have some sort of app store lineup that we would go through.
And what kind of presentation do you do at a system or at a hospital, in terms of you go on site, do you do it over, do it online? Do you just send some written materials? I'm just curious about how you're handling that part of the
Yeah, we
marketing.
typically we'll do a demo on Zoom or some sort of what video conferencing site, and whatever they want to use, we'll use that, and we'll demo the software in a real environment, so they
Wow.
can see how it works.
All right. Did I forget to ask any questions, or is there anything else you want to tell us either about juggling being a hospitalist and a founder, a co-founder? I guess technically you do have a partner, but I mean you were
Well,
the one that created it, so I guess you
yeah.
are the founder. Juggling those things, or about AI Medica.
No, I just think I do have hobbies that I use to not do work. So I think it's important to have those so you're not doing it. So I play piano. I do a couple of things to kind of keep my mind off it when I have a couple minutes of downtime, which is I think important as you're looking to try to do other things with your time.
What do you think is going to happen with you? Are you, if this
Yeah.
gets really big, it's going to take more and more management. Do you see yourself eventually? I mean, I don't, hopefully your employer at the hospital is not listening, but they probably know you got this thing going on. So what do you kind of think will happen long term? Are you going to become like like a CMIO, in a hospital, informatics and this technology, or do both for a long time? What do you think?
I'll tell you, John, I actually love being a clinical doctor. I love taking care of patients. And maybe not as much as I've had to in the past. I'd like to probably wind that down a little bit because I do work quite a bit. So what I see myself probably doing the next, 5-10 years as I see guys up and it's profitable and we're able to keep lights on, is probably work for them full time and work my company full time and then still see patients. Because I find myself as a chief medical officer of the company and using the tool, I find by me using the product and practicing patients, I really understand what the problems we're trying to solve. I feel like if I remove myself from clinical practice 100%, my utility to the company to help make these tools better, I think it becomes limited as well.
Well, that reminds me, Cleveland Clinic, it's a pretty big place.
Mm-hmm.
And I don't know about the current CEO, but the former CEO was still clinically practicing while he was running that monstrosity. So, you can keep practicing probably as long as you like, and if you're enjoying it.
I do enjoy it.
All right. Well, I think that's all the time we have. So I really appreciate that. I'm going to put the links in the show notes. Again, it's AI Medica. And I've been talking to Dr. Adam Robison. So I don't know. This has been. I'm gonna have to have you come back in a couple of years and see where things have gone, and or maybe by then I'll have invested in it as it'll be a listed stock or something. All right. Thanks for being here, Adam. I really appreciate it.
Absolutely. Thank you.
Okay. Bye bye.
Bye.
All right. Perfect. Yeah. It's about 30 minutes and I had all my questions. Anything you can think of now that I forgot or that
No, I thought you did great.
if you need to send me anything in the meantime, but I know that I think I'm slotted to let me pull up my schedule here for this thing. Where is
How
it?
long have you been doing this for while you're pulling it up?
Oh, how long have I been doing this?
Yeah,
6 years. I think this is episode 333 or
that's awesome.
334. So I don't know. It's more of a hobby than anything, but um, I'm going to keep doing it for a while. I only practice, I don't even practice really. I supervise APNs and PAs at some urgent care centers. I mean, I obviously have to be licensed to do that, but I don't see patients anymore. So, but I don't think I can do that for much longer. So I'm going to have to stop. But anyway, I enjoy doing this. It's fun to talk to people like you.
I'm sure
Anyway,
anything
I
else.
think it's going to be posted in about 3 weeks.
3 weeks. Okay, sounds great. We'll look
And
forward to it.
yeah, and I will send you everything, links and a copy of the MP3 if you want, and then it'll won't show up on YouTube till much later. I have someone else take care of that. But and if I have any questions in the meantime, I will get a hold of you and get those answered.
It was nice talking to you, John. I really enjoyed talking to you. I'd love to. I should ask you more questions about yourself because I'm actually very curious how you came up with this 6 years ago. I'd love to talk.
We can talk again sometime,
Yeah,
anytime.
yeah, absolutely. We'll talk to
But
you there.
all right, take care.
Thank
See
you.
ya.
Bye.
It seems that each new company startup involving physicians at least follows a unique journey. They all go about creating their new business in a somewhat unique way. But the common thread is a desire to solve a problem experienced by them and their peers in the daily delivery of patient care. As I even mentioned during our conversation with Adam today, there was a guest of mine who was a urologist who had a patients having a problem getting some good underwear when they had incontinence. And so she developed her own company to produce those products. I've talked to several others that have done this kind of thing. So that's just usually how it goes. And Dr. Robison's story serves as an inspiration for other physicians like you looking to improve the quality of care or the care delivery process. That if you can muster enough time and energy and maybe money, find a partner and what have you, and you can solve a problem like this and create a company by doing so. So, as I've talked about in the past, one of the best ways to earn money once you get over the initial problems starting it, but once you get over that, and if you can start a company, start a business, not only can you earn money that'll be equivalent to what you can make as a physician ultimately, but when the time comes to cash out, or if it goes public, that doesn't happen very often, but one way or the other, you can get your money out of a business, and that becomes a big asset. So I'm thinking that if AI Medica continues to grow and add new clients the way it has, it could be very good for the shareholders, whoever's owning the company besides the founders. All right. If you have questions for Adam about AI Medica, bringing it to your hospital, or related issues, you can reach him via LinkedIn or at his email address, which is actually listed in his LinkedIn profile, but I will also put it in the show notes. And there'll be a transcript and other links to related material. A quick reminder that I'm still got my 10 popular non-clinical careers giveaway freebie. It's a 20-page guide to non-clinical careers in case you need some ideas about what you might pursue if you're thinking about leaving medicine or at least full-time medicine. You can get that at nonclinicalphysicians.com/free guide. I also have a handout that goes through a list of more than 70 non-clinical careers, and you can get that at nonclinicalphysicians.com/70 jobs, all one word. All right. Remember that this podcast is made possible by the support of the University of Tennessee Physician Executive MBA program. You can learn more about that at nonclinicalphysicians.com/physician MBA. Some of the links that I refer you to and that you'll find in the show notes perhaps at times are affiliate links, which means that I get a payment, if you buy something using that link. So the price is exactly the same, whether you buy it that way or directly from the producer of the item, but you just need to be aware of that. I also will remind you that the opinions expressed here are mine and my guests, and while the information provided on the podcast is true and accurate to the best of my knowledge, there's no guarantee that using the methods discussed here on the podcast will lead to success in your life, career, or business. So always get your consultants involved, like your attorney, accountant, or career strategist, before making any major decisions about your career or about starting a business, for example. All right, I hope to see you here next Tuesday when I'm not sure who I think I'm going to be presenting a follow-up interview and conversation with Dr. Luisa Caprano, maternal fetal medicine expert who has been able to build a business using telemedicine consultations as a big part of it. So we'll have that next Tuesday. Hope to see you then. Bye-bye.